Welcome back, everyone, to the second episode of WombWise. We're really glad you could join us again.
Yes, welcome, and hello if you're tuning in for the first time.
So, WombWise, just as a reminder, is brought to you by Fertilope. They're a fertility concierge based over in Ahmedabad. Think of them as, like, your expert friend for navigating IVF. They help couples worldwide get clear info, real support.
Yeah, their whole mission is basically to make IVF feel, well, less confusing and overwhelming, more manageable.
Exactly. And they have this amazing range of services to help with that.
They really do. Things like matching you with the right doctors and clinics. That's huge.
Oh, definitely. And handling appointments, communication, all that logistical stuff.
And they even help arrange longer stays in India if you need it, with comfy accommodation, even regional meals cooked like home.
Which, when you're going through something like IVF, that kind of comfort is just invaluable, isn't it?
Absolutely. It makes such a difference.
But it's not just the practical side, is it? They really get the emotional piece, too.
Oh, for sure. They focus a lot on emotional wellness. So, things like yoga, special garb sand scar classes, counseling support.
Yeah, it all ties together. Their whole thing seems to be making IVF affordable, personalized, and just comfortable.
So you can focus on the main goal, right? Building your family.
Without all the extra stress about costs or getting lost in the system.
It's a really thoughtful, sort of holistic approach. Medical, emotional, practical, all covered.
Okay, so today we wanted to tackle a big topic. Lots of confusion around this one. We're debunking some common myths about who actually needs IVF.
And exploring, who really can benefit from it. There are just so many assumptions floating around.
Totally. Our goal is just to bring some clarity, dispel some of those misconceptions using the info we've looked at.
Yeah, cut through the noise a bit, help people feel more empowered with the facts.
All right, let's start with maybe the biggest one. The myth that IVF is basically just for older women.
Ah, yes, that one comes up all the time.
Such a common perception, right?
It is. And look, it's true that fertility naturally declines with age. That's biology.
Sure.
But that definitely doesn't mean younger people don't face their own fertility hurdles where IVF is, the best answer.
Exactly. Focusing only on age just misses so much of the picture.
Right. The reality is IVF helps people across many ages for all sorts of reasons that aren't just about getting older.
Yeah, we're talking younger couples dealing with, say, male factor infertility, problems with sperm count or movement.
Or things like blocked fallopian tubes. Maybe from an old infection, or endometriosis can cause that too.
Right, or issues with ovulation, not releasing eggs regularly.
Exactly. Endometriosis itself too. And sometimes, frustratingly, there's just no clear reason found. Unexplained infertility.
Yeah, that's tough. We saw a quote from Boca Fertility that put it really well.
Oh, yeah.
They said something like, IVF is not exclusively for older women. Many younger couples and individuals also benefit from IVF when facing issues like male infertility, tubal blockages, endometriosis, or unexplained fertility problems.
That sums it up perfectly. It just shows infertility is complex. It doesn't just look at your birth year.
Not at all. It underlines that fertility challenges aren't just tied to a woman's age.
Okay, next myth. This one carries a lot of hope, but also potential disappointment.
The idea that IVF always works, or that it guarantees a baby.
Yeah. Oh, if only. That would be amazing, but it's just not how it works.
No. It's a powerful tool. It's helped so many families, but success isn't guaranteed.
Right. Success rates vary quite a bit based on different things. Age is definitely one factor.
Like for women under 35 in the U.S., the average live birth rate per cycle is around 40%, something like that.
Yeah, around there. But that's an average, individual situations differ.
And those rates do tend to go down as women get older. That's just a reality we have to acknowledge.
Absolutely. So IVF definitely improves the chances for many people, but it often takes more than one try.
It's not a magic wand, unfortunately. Managing expectations is key.
So important for navigating the emotional side of it all.
Okay, another one. I think this comes from like the early days of IVF.
The multiples myth. Twins and triplets everywhere.
Yeah, that IVF almost always means you'll have twins or more.
Right. That perception is kind of rooted in the past when transferring multiple embryos was more standard practice.
But things have changed a lot, haven't they?
Massively. Modern clinics really prioritize safety now.
So the trend is much more towards single embryo transfer, elective single embryo transfer, or ESET.
Exactly. To lower the risks that come with multiple pregnancies, risks for both the mom and the babies.
Makes sense. Health first.
And the stats back this up. We saw data showing something like 87% of IVF live births now are single babies.
Wow, 87%. That's high.
Yeah, and only about 12% are twins. It's a huge shift from the old image.
Definitely shows how the practice has evolved. And doctors are much better now at picking the best single embryo too, right?
Precisely. Careful selection helps ensure healthier pregnancies, usually with just one baby. It's all about optimizing success and safety.
Okay, let's talk about money. The myth that only rich people can afford IVF.
Ah, the cost barrier. It's a very real concern for so many. IVF isn't cheap.
No, it's definitely a significant investment.
There are people and organizations like Fertilope working hard to make it more accessible.
Yeah, Fertilope in India is really focused on that, trying to make quality IVF more affordable
How do they do that?
through things like offering financing options, working with clinics on package deals, helping plan the whole thing to manage costs.
That's great, making good care more reachable for more people.
And actually, we talked about some cost-saving tips back in our first episode, didn't we?
We did, so listeners can always go back and check that out if cost is a big concern.
Good point. Okay, last myth to bust for now. This one always gets me.
Which one?
The idea that IVF is just for women. Like it's a woman's problem or treatment.
Oh, right. That's a big misconception. Needs clearing up.
Totally. Infertility affects couples, individuals.
Yeah.
And male fertility is equally important, isn't it?
Absolutely critical. Focusing only on the women just ignores half the equation, potentially. Men's health matters hugely.
And IVF often directly tackles male fertility issues, right?
Definitely. Especially with severe male factor infertility, low sperm count, poor shape, slow swimmers.
What's the solution then?
IVF with ICSI, that's intracytoplasmic sperm injection.
Right, ICSI.
Yeah, it's often the best, sometimes the only option in those cases. They basically inject one good sperm right into the egg in the lab.
So it bypasses any issues the sperm might have getting there on their own.
Exactly. So yeah, definitely not just for women. It treats the couple or the individual addressing whatever the specific challenge is.
Okay, so that busts some myths. Now let's talk about who can benefit. What specific situations make IVF a good option?
Well, building on what we said, let's start with blocked or damaged fallopian tubes.
Okay. That seems pretty clear-cut.
It really is. If the tubes are blocked, maybe from infection, surgery, endometriosis, the egg and sperm just can't meet naturally.
So IVF bypasses the tubes entirely.
Precisely. They retrieve eggs from the ovaries, fertilize them in the lab, and put the embryo directly into the uterus. Problem solved, essentially.
Makes sense. And then male factor infertility, which we just mentioned, the ICSI.
Yes. Low count, poor shape, poor motility. Anything that makes it hard for sperm to fertilize an egg naturally.
IVF with ICSI gives each egg a much better shot.
A much better shot, yeah. And again, lots of younger couples need IVF because of male factor issues. It's not just an older couple thing.
What about issues on the woman's side, like with ovaries or ovulation?
Good question. IVF can be really helpful there too. So for women with diminished ovarian reserve, fewer eggs left.
Okay.
Or women who don't ovulate regularly or at all, maybe due to PCOS, polycystic ovary syndrome.
How does IVF help then?
The fertility drugs used in IVF stimulate the ovaries to produce multiple eggs at once.
Ah, so more eggs retrieved means more chances.
Exactly. More eggs hopefully means more embryos, increasing the odds of success. Even if a woman does ovulate, IVF can still help get more eggs than a natural cycle.
So some women with these issues might go straight to IVF.
Sometimes, yeah. If ovarian reserve is low or simpler treatments haven't worked, they might opt for IVF sooner to maximize their chances.
Okay. What about conditions like endometriosis or maybe uterine problems?
Yeah, those can definitely impact fertility. Endometriosis can cause scarring and inflammation.
Making it hard for an embryo to implant.
Or even interfering with ovulation or the tubes. Uterine issues too, like fibroids or a septum that's like a wall inside the uterus, they can block implantation.
So IVF can help how?
Well, sometimes surgery is needed first to fix the issue, like removing fibroids or correcting a septum. But then IVF can help achieve pregnancy afterwards. Or sometimes IVF helps bypass the problem areas altogether.
Right. We heard about that young couple, didn't we? The woman had a uterine septum.
Yeah, the story was they had surgery to fix it, and then they had success with IVF. Shows how these things can interact.
Definitely. Okay, what about when doctors just can't find a reason? Unexplained infertility.
That's incredibly frustrating for couples. You do all the tests, everything looks normal, but pregnancy just isn't happening.
So what role does IVF play then?
Often, after trying simpler things like IUI and short-term insemination without success, IVF becomes the next logical and often most successful step.
Even if you don't know exactly why it's working better.
Kind of. IVF provides a very controlled environment for fertilization and early growth. It might overcome subtle issues that standard tests just don't pick up.
Gotcha. And of course, we have to talk about age again, older women, and diminished ovarian reserve.
Yes. It's a reality that egg quality and quantity decline, especially late 30s into the 40s.
So IVF becomes a more primary option then.
Often, yes. For women in that age group struggling to conceive, IVF can be a more direct path, and if their own egg quality is a major concern.
There's the option of donor eggs with IVF.
Exactly. A very successful option for many building their families later in life.
IVF also has this amazing capability for families with genetic conditions, right?
Oh, absolutely. PGT, pre-implantation genetic testing. It's incredible technology.
So how does that work?
If a couple knows they carry a risk for a specific inherited disease, like cystic fibrosis or sickle cell,
Right.
they can do IVF, create embryos, and then test a few cells from each embryo for that specific genetic mutation before transferring any to the uterus.
Wow, so they only transfer the healthy embryos.
Precisely. It allows them to avoid passing on the condition. We saw it described as ideal for families at risk of passing on genetic conditions. It selects the unaffected embryos.
That's life-changing for those families.
Truly. And one more group, cancer patients.
Right. Cancer treatments can sadly impact fertility.
Very much so. Chemo, radiation, they can damage eggs and sperm.
But there are options beforehand.
Yes. Fertility preservation, freezing eggs or sperm before treatment starts is crucial.
And then later.
Later, they can use those frozen eggs or sperm with IVF to try and have children. Sometimes donor gametes might be needed too, but IVF provides that pathway.
It's just amazing how versatile IVF is. It covers such a wide range of situations.
It really does.
So the big takeaway is IVF isn't just for older women, not by a long shot.
Nope. It's for anyone, really, facing fertility challenges that simpler methods can't overcome. Doesn't matter the age.
Like that young tech couple in India you mentioned, needing IVF after surgery for a uterine issue and having twins in 2023.
Exactly. A perfect example. Specific medical needs drive the decision, often regardless of age.
Okay, let's quickly circle back to Fertilope then, and how they support people through all this.
Yeah, because navigating IVF can feel like a maze. Fertilope really tries to simplify it.
Acting like that concierge, yeah. Matching you with top doctors, good clinics.
Handling the appointments, the communication, all those details that add up.
And the long-stay support in India with the comfy housing and the regional meals.
Yeah.
That personal touch.
Makes a huge difference. And the emotional support is key too.
Right. The yoga, Garb Sanskar, counseling.
We know things like prenatal yoga can genuinely reduce stress, help with sleep, which is so needed.
Absolutely. Their whole mission seems to be making it affordable, supportive, making sure couples feel cared for.
From start to finish, consultation to, hopefully, holding their baby without breaking the bank or losing their minds with stress.
A smoother, more positive journey. That's the goal.
Definitely.
Now, if you listening want to learn even more, reading can be super helpful. We found some great book recommendations.
Yeah, some really solid resources out there. For egg quality, It Starts with the Egg by Rebecca Fett is often mentioned.
Heard good things about that one. For a couple's perspective, maybe more lighthearted.
Get a Life, His and Hers Guide to IVF by Rosie Bray and Richard Mackney. They share their own story, apparently with some humor.
Nice. And for hormone balance and lifestyle.
The Woman Code by Elisa Vitti gets recommended for that.
Okay. What about a more practical guide covering science and emotions?
Empowered Fertility, a practical 12-step guide. That's by Claire Hall and Dr. Devora Lieberman.
Sounds comprehensive.
And for coping with the emotional side specifically, the ups and downs.
There's Not Pregnant, a companion for the emotional journey of infertility. Kathy Quillett and Dr. Shannon Sutherland. Sounds very supportive.
And one more, for a bit of humor again.
Hilariously Infertile by Karen Jeffries, a memoir approach.
Sounds like a good mix. Experts and patients seem to rate these highly for insight and support.
Yeah, lots of different angles covered depending on what you're looking for.
Beyond books, what about actual products that can help during the process?
Oh yeah, practical things can make the day-to-day easier, like those IVF organizer kits.
You mean like the MyVitro Essential IVF Support Kit?
Exactly. Things with a caddy for meds, a shot station, fridge box, travel case, even hot-cold packs for injection sites.
Designed by people who've been there.
Often, yeah, so they really get the practical needs.
And supplements. Prenatals are key, obviously.
Definitely. Good quality prenatals with folate methylfolate is often preferred, and antioxidants.
What about others? We heard about myo-inositol.
Yes, things like ovocidol. There's growing research suggesting it might help improve egg quality, maybe sperm quality too. Worth discussing with a doctor for sure.
Okay. Comfort items too. Stress relief is huge.
Absolutely. Simple things like a heating pad or maybe a weighted blanket.
Oh, weighted blankets are great for anxiety and sleep.
Exactly. Anything that helps manage the physical and emotional stress.
And the pineapple thing. That's kind of fun.
Yeah. The pineapple has become this symbol in the fertility world, hasn't it?
Like a symbol of hope and community. So you see pineapple ice packs, pineapple socks, jewelry.
We saw a blog call it the unofficial symbol of the infertility community. A bit of fun and encouragement.
Totally. And finally, wellness tools.
Yeah, things like a yoga mat for gentle movement. Meditation apps are fantastic for stress.
Or just journaling, getting thoughts and feelings out.
Yes. An infertility journal can be a really valuable outlet. It's all about supporting your mental and emotional well-being through a tough process.
Okay, great suggestions. Let's quickly hit some FAQs, questions we hear a lot.
Good idea. Let's clarify those key points again.
First one, is IVF only for older women? Let's nail this one down.
Okay, final answer. Absolutely a no. Unequivocally no.
Right.
While it helps older women, it helps so many others too. Remember that clinic quote? Not exclusive. Helps with male factor, tubes, endo, unexplained.
So it's for any couple, any age, who needs it after other things haven't worked.
Exactly. Age isn't the only ticket in.
So then who besides older women might need it? Just to list them out again.
Sure. Couples with male infertility, often needing ICSI. People with blocked tubes. Uterine issues like fibroids or septum scarring.
Severe ovulation problems like PCOS.
Right. Even women with good eggs who haven't conceived with simpler steps. Single women using donor sperm. Cancer survivors using preserved egg sperm.
Basically anyone facing fertility hurdles that need that next level of intervention.
Precisely. If simpler doesn't work, IVF is often the answer, whatever the reason.
Okay. And can IVF actually solve men's fertility problems?
Solve is a strong word, but it can certainly overcome many of them, especially with ICSI.
Right. The direct injection for low count or poor quality sperm.
Yeah, it gives those sperm the best chance. Male factor is a super common reason for IVF, and sperm health matters any age in IVF.
Good point. Last FAQ. Can IVF help avoid passing on genetic diseases?
Yes, definitely. Through PGT, pre-implantation genetic testing.
Screening the embryos before transfer.
Exactly. For specific known genetic conditions in the family. Allows selection of embryos without the condition.
Like that quote said, ideal for families at risk of passing on genetic conditions.
Yeah, a huge relief for those couples.
So wrapping up, it's just so clear, isn't it? IVF is this incredibly versatile tool.
Absolutely. For a huge range of challenges, affecting all sorts of people, not just defined by age.
It really offers hope and options where maybe there weren't many before.
A testament to how far reproductive medicine has come.
And remember, Fertilope is there to help make that journey smoother, less stressful, more supported.
They really aim to be that helpful guide.
So if you found this useful, please do subscribe to WombWise. We've got more episodes coming up covering different fertility topics.
We'd love to have you join us again to keep learning together.
And do check out the description below for links to the books and products we mentioned. They might offer some support.
Every little bit helps on this journey.
And crucially, if you need personalized help, if you want to see how Fertilope could support your specific situation,
What should they do?
reach out to Fertilope directly through LinkedIn. We've put the link right there in the description. They can offer tailored advice.
Definitely worth exploring if you need that support.
We really hope this conversation has helped clear up some confusion about who needs IVF and what support is out there.
Yes. Wishing everyone listening all the very best, wherever you are on your path.
And just one final, very important reminder from us.
Always the disclaimer.
Yes, the information in WombWise is purely for educational purposes. It's not medical advice.
Please, always, always talk to your own fertility doctor or specialist. They know your situation best and can give you personalized guidance and treatment.
Absolutely. Your doctor is your primary source for medical advice.